I'm going.
Hello again, I'm Dr. Sean Allen here in Chicago, Illinois. I'm here with my partners Chris Corfist from Slow Guy Speed School, Dan Fichter from wannagetfast.com, and my partner in Dillon, Colorado, Iowa Wearlop. We are the Gate Guys. You can see our web addresses at the front of this clip. Please go to our websites and check out some of our free articles, free podcasts. We've got some DVDs for sale. This is another clip in some of our gait progression, and we're going to look at an assessment today. We've been talking about a lot of ankle rocker, but I've not shown you guys truly how to assess it in a non-weight bearing position. It's important that you note that in this assessment, the positioning of the foot, the position of the patient's foot, and the position of your hands in measuring the range of motion is critical. And if you don't do it correctly, you're going to get bad information. Bad information then can lead to bad assessment or diagnosis, and then can lead to bad choices of exercises for the client. It's real important that, and we've mentioned this on some of the blogs on Want to Get Fast, that you can't just throw any exercise at a foot type or at an ankle rocker deficit. You need to know the foot type. Do they have a rear foot varus? Do they have a forefoot varus? Do they have a forefoot valgus? Do they have tibial varum? You need to take all of these components into consideration when you look at ankle rocker deficit and measuring it, because your choice of exercise is going to be dictated upon what foot type that you have. If you're unfamiliar with some of the things that I've just spoken with, please go onto YouTube and have a look at some of those videos on forefoot varus, rear foot varus, forefoot valgus, etc. Or you can get some of our DVDs, which are far more in depth, have got anatomy pictures and slides, and have the exercises lined out per choice of foot type. So let's just go on our little excerpt here, an evaluation. Typically when we see the assessment for ankle rocker, we see a lot of people just taking the foot and pushing it up into here. Remember, we're trying to get past that 90-degree mark, trying to get to the magic 100 to 110 degrees of ankle rocker, which is the movement at the tibial talar joint. And we need to have at least 100 degrees in order to progress forward. If we get stuck at 90 or less than 90, we're in relative plantar flexion as opposed to relative dorsiflexion. And that is impaired ankle rocker. So the problem with this is, I'm going to take this foot and just drop it out for a moment. If I take the foot and I take it in a neutral forefoot position and I just push forward, which would make sense, I can get a faulty ankle rocker by pushing hard enough that I either push through the arch, or if I evert the foot, the forefoot, I can actually gain more range there. And this is a faulty assessment for ankle rocker because I have not locked out some of the rear foot mechanics. You need to be able to take the foot and invert the rear foot, because we heel strike laterally. In the gait cycle, we heel strike laterally. The rear foot is somewhat locked up, but the anatomy is in the right position to put the foot down to progress laterally to medially, and then progress ankle rocker over top of that neutral position. We've showed this in one of our other videos. If you look at the foot and look at the tibial position, if we're locked at 90, in other words, we can't get to our magic 100 to 110 degrees. If I collapse the foot, you can see that the tibia moves forward. This will drive the knee and the body mass forward, and you can have a person progress over top of this impaired ankle rocker merely by collapsing the foot into hyperpronation. And ruining the ankle, the foot tripod positioning. So again, this is one of the 6 strategies on our 6 strategies of getting across a deficient ankle rocker, and it's one of the YouTube clips that we have. Again, dropping through the arch will progress the tibia into what appears to be dorsiflexion. The ankle rocker range has not changed, but you've impaired the actual, you've changed and altered by cheating or compensating the actual tibial progression angle. And so now the knee will flex and the body weight can move over top of this foot, although at the consequence of flattening the foot. So what you want to do is you want to take the foot, you want to invert the rear foot, and then pull into this position to get a true assessment. So from the side, invert the foot, now go into here. And I have probably close to 100 degrees there. And so this is adequate ankle rocker. And a lot of people, you will get, to do it incorrectly, square up the foot and you'll get a ton of range. As you can see, I can get more here. But when you do this, they'll block out early and you can't get that range. Okay. This will cause excessive lateral weight bearing here if they try and stay out on the strategy, or they will have to pronate through the midfoot or do one of the other 5 strategies that we talked about in one of our other assessments. So again, invert the foot, pull into this range here to check for ankle rocker. Don't take the foot to neutral, because I can get a lot more range that way. Okay, so this is our assessment, just a simple assessment for ankle rocker in the supine non-weight bearing position. Please be aware that just because a client has full ankle rocker on the table doesn't mean they're going to use it on the ground. And then we go into this in depth in some of our DVDs in our lecture series. Just because they have it doesn't mean they're going to use it. Okay, so again, I'm Dr. Sean Allen with the Gait Guys, the Homunculus Group. Want to get fast and slow guy speed school. Thanks for watching our videos, and we'll see you guys next time.